Hey everyone, ready for another exciting session? Today, we're diving into the world of fluoride. I promise to make it as fun and engaging as possible, so you can easily absorb all the important info. Let's get started. Let's talk about how fluoride helps prevent dental caries. The most significant mechanism of action for fluoride is remineralization. This process actually reverses the caries process and makes enamel more resistant to decay, thanks to larger crystals. Think of it as giving your teeth a superpower. Fluoride also seals dentinal tubules, which helps alleviate pain from dental hypersensitivity. It interferes with microorganisms, reducing the ability of plaque to form acid. It also reduces enamel solubility by converting hydroxyapatite to fluorapatite, making enamel more resistant to caries. Fluoride can be acquired systemically, which is through the bloodstream, or topically, which is directly applied to the teeth. Systemically, fluoride is incorporated into developing enamel during mineralization and after mineralization, but before eruption. It comes from water, prescribed dietary supplements, and certain foods. Topically, fluoride is applied directly to the enamel post-eruption through water fluoridation, gels, toothpaste, mouth rinses, and tablets. This helps with remineralization and doesn't cause fluorosis since it's not ingested. Water fluoridation is an ideal public health measure because it's effective, safe, and inexpensive. It requires no direct action from individuals and benefits everyone, regardless of their financial resources. The current recommended fluoride level is 0.7 parts per million. This adjustment has helped reduce dental caries significantly. Fluoride helps reduce caries by as much as 20 to 40% due to its widespread use in products like toothpaste and mouth rinses. Additionally, it saves money over a lifetime, amounting to the cost of just one filling. Fluorosis, which can result from excessive fluoride intake during enamel formation, is more of a cosmetic issue than a functional one. It ranges from mild white spots to severe brown stains and pitting. Fluoride is found in various products we use daily. Toothpaste containing fluoride helps reduce decay, and for children under 2 years old, just a smear is recommended, while for those between 3 and 6 years old, a pea-sized amount is sufficient. Mouthwash, although effective, isn't recommended for children under 6 due to the risk of swallowing. Professional fluoride varnishes are applied every 3 to 6 months, especially for high caries risk patients. There are different types of professional fluoride treatments. Sodium fluoride is safe for tooth-colored and porcelain restorations and is typically applied using a tray method. Sodium fluoride varnishes contain 5% sodium fluoride and are effective for desensitizing roots and preventing caries. Acidulated phosphate fluoride, while effective, should be avoided with tooth-colored restorations and porcelain, as it can cause surface roughening or pitting. Stannous fluoride, despite causing staining, is highly effective and provides a strong defense against decay. It's important to be aware of fluoride toxicity. Acute toxicity can cause symptoms within 30 minutes, including nausea, vomiting, and diarrhea. If this happens, inducing vomiting and drinking milk can help bind the fluoride. Chronic toxicity, on the other hand, can lead to skeletal fluorosis after long-term exposure to high levels of fluoride. Now, let's talk about fluoride supplementation based on age and existing fluoride levels in drinking water. For babies from birth to 6 months, no fluoride supplementation is needed. For children 6 months to 3 years old, if they receive less than 0.3 parts per million of fluoride at home, they should get 0.25 milligrams per day. If they're getting between 0.3 to 0.6 parts per million, no supplementation is needed. For children between 3 to 6 years old, if they have less than 0.3 parts per million of fluoride at home, they should get 0.5 milligrams per day. If they're receiving between 0.3 to 0.6 parts per million, they should get 0.25 milligrams per day. For kids aged 6 to 16 years old, if they receive less than 0.3 parts per million of fluoride at home, they should get 1 milligram per day. If they receive between 0.3 to 0.6 parts per million, they should get 0.5 milligrams per day. Remember, if anyone is already getting more than 0.6 parts per million of fluoride in their water, no additional supplementation is needed. This is because they're already receiving enough fluoride for optimal dental health. Let's explore more about how fluoride works in different forms. Topical fluoride can be professionally applied through various methods. Sodium fluoride is a common choice, especially for those with tooth-colored and porcelain restorations. It's typically applied with a tray method for a 4-minute application, which is the most effective way to combat rampant caries. For the best results, make sure not to eat, drink, or smoke for 30 minutes after application. Sodium fluoride varnishes are another option, containing 5% sodium fluoride. These varnishes are particularly useful for desensitizing exposed roots and preventing caries. They adhere to the teeth for 24 to 48 hours, releasing fluoride gradually and providing extended protection. Acidulated phosphate fluoride, while effective, is not recommended for patients with tooth-colored restorations and porcelain due to its potential to etch the surfaces. It can be applied using a tray or painted on, and it comes in gel and foam forms. Stannous fluoride, although it can cause staining and has a bitter taste, is very effective in strengthening enamel and preventing decay. When it comes to fluoride in toothpaste, daily use is highly recommended for all patients to reduce decay. For young children, it's important to use a very small amount, just a smear for those under 3, and a pea-sized amount for those aged 3 to 6. Fluoride mouthwashes are also beneficial, though they should be avoided for children under 6, due to the risk of swallowing. Now, let's discuss what happens when fluoride is taken in excessive amounts. Acute fluoride toxicity can occur if a large amount is ingested at once, causing symptoms like nausea, vomiting, and abdominal pain within 30 minutes. In such cases, inducing vomiting and drinking milk can help, as milk binds with fluoride and reduces its absorption. Chronic fluoride toxicity, on the other hand, can lead to conditions such as skeletal fluorosis after long-term exposure to high levels of fluoride, particularly above 8 to 10 parts per million. Understanding fluoride's role in caries prevention is crucial. It's a bacterial disease, and the primary factors involved are the tooth surface, bacteria, and fermentable carbohydrates like sugar. Streptococcus mutans and Streptococcus sabrinus are responsible for initiating caries, while Lactobacillus and Actinomyces viscosus are involved in the progression of the disease. Remember, caries is driven by the frequency of sugar intake, as frequent exposure to sugars reduces saliva's ability to buffer acids, leading to a more acidic environment that favors demineralization. Saliva acts as a natural buffer, neutralizing plaque acids and aiding in the remineralization process. High salivary flow is beneficial, while low salivary flow, or xerostomia, increases caries risk. Different types of caries include rampant caries, which progress rapidly and require urgent treatment, and chronic caries, which progress slowly and are typically brown or black. Arrested caries appear firm with a glass-like surface and indicate remineralization. Recurrent caries occur at the margins of restorations and can lead to further decay if not addressed. For effective caries detection, radiographic examinations like bite wings and periapical films are essential. Carious lesions appear as radiolucent, dark areas on radiographs, making it easier for dental professionals to identify and treat them. To sum it all up, fluoride is an invaluable tool in dental health, offering a range of benefits from caries prevention to sensitivity reduction. Whether through water fluoridation, professional applications, or daily use products like toothpaste and mouthwash, it plays a crucial role in maintaining strong, healthy teeth. Keep these points in mind as you continue your journey toward dental health excellence. That wraps up our fun and engaging session on fluoride. I hope you found it informative and enjoyable. Stay tuned for more exciting topics that make learning about dental health a breeze.